Can I ask you something a little uncomfortable? If you sat across from me in my clinic and I looked at your chart and said, based on everything I know about your biology, I can tell you the most statistically likely way your body will begin to struggle after 60, would you actually want to know? Most people nod and say yes without hesitation, and then they walk out of the room and spend the next 10 years ignoring the exact piece of information that could have changed everything. I'm Dr. Meilin. I've spent years working in preventive medicine, and I've noticed something that honestly still surprises me. There is a piece of biological data that every single person has carried since the moment they were born. It's probably sitting on a card in a drawer somewhere in your house, or it's printed on a hospital form from 3 decades ago that you haven't looked at since, and it happens to be one of the most overlooked biological indicators we have for understanding how your body ages. I'm talking about your blood type. Not the way diet books talk about it, not the way wellness influencers on social media talk about it. I'm talking about what large-scale, peer-reviewed research has been quietly showing us for years. Studies that tracked hundreds of thousands of patients across multiple decades have revealed something fascinating: your blood group leaves a measurable fingerprint on how your cardiovascular system holds up over time. It influences how your brain weathers stress. It shapes the way your immune system responds when it's truly under siege. And yes, statistically speaking, it points toward the health challenges that are most likely to arise if you don't intervene early. Today, I want to walk through this with you. We're going to talk about every blood type, O, A, B, and AB, and for each one, I'm going to share something that most physicians don't usually bring up in a routine 15-minute visit. Not because anyone is keeping secrets from you, it's simply that there isn't enough time in a standard appointment to connect all these dots in a way that makes sense, so I'm going to connect them for you right now. But please, stay with me until the end of this conversation. There is a modifier that sits on top of every blood type. Something beyond the letter on your card that shifts your personal risk profile in a significant way, and most people I meet have never once considered it. Before we go any further, do me a quick favor, tell me in the comments what your blood type is, O, A, B, or AB. I'll be walking through each one individually, and knowing yours will make what comes next much more personal and relevant to you. Let's start with type O. I want to frame this a little differently than you might have heard before. Type O is by far the most common blood type on the planet. Roughly 45% of people carry it, and for most of human history, that was likely a tremendous survival advantage. Type O blood appears to have emerged in our earliest ancestral populations. These were environments that demanded serious physical endurance. They required a robust immune response to parasitic infections, and they shaped a digestive system that was remarkably efficient at processing large amounts of animal protein under stressful conditions. But what does that ancient blueprint look like inside a modern body after 60? On the cardiovascular side, people with type O blood tend to carry lower circulating levels of something called von Willebrand factor. That's a protein that plays a central role in clotting. When you have less clotting activity, what you get is smoother blood flow through your vessels. You get less platelet aggregation, and statistically, you get a meaningfully lower risk of those dangerous arterial blockages that lead to heart attacks and ischemic strokes. Multiple large-scale studies have confirmed this over the years. Type O individuals carry a genuinely lower risk of coronary artery disease when you compare them to AB and AB combined. That's the good news, and it is genuinely good news. But here's what almost nobody tells men and women with type O blood once they pass 50. That cardiovascular advantage can quietly turn into a psychological trap. I've seen this pattern play out more times than I can count. A type O patient comes in for their checkup, late 50s. Blood pressure looks fine. Cholesterol is manageable. No strong family history of heart disease. And because they feel structurally protected, because the numbers look reassuring, they stop paying attention to the other systems in their body that are quietly beginning to erode. They ignore persistent fatigue. They brush off digestive complaints that have been lingering for months. They push through joint pain and tell themselves it's just part of getting older. Because the heart seems fine, they assume everything else must be fine too, and that assumption is where the vulnerability lives. Type O's most serious age-related risks don't actually come from the heart, they come from below it. The stomach lining of someone with type O blood expresses certain surface receptors, and the bacterium, called Helicobacter pylori, H. pylori for short, finds those receptors easier to attach to than those of any other blood type. Here's the thing about H. pylori, it isn't loud. It doesn't announce itself with sharp, unmistakable pain in most people. It moves in quietly. It colonizes the gastric mucosa, the protective lining of your stomach, and then over years and decades it slowly breaks that lining down. Left undetected, this creates a slow and steady escalation, chronic gastritis. then peptic ulcers, and in a meaningful percentage of cases, it can progress to gastric cancer, and gastric cancer caught late is one of the more difficult cancers to treat successfully. There's something else the research tells us. Type O individuals also show a measurably elevated risk for certain peptic ulcer complications that end up requiring surgical intervention. This isn't theoretical, it's documented in the medical literature. So here's my straightforward advice. If you have type O blood and you're over 55 and you've never been tested for H. pylori, that is the single most important conversation to have with your doctor this year. It's a simple stool antigen test or a breath test. It's not expensive, and for you specifically, this isn't just routine. Caution: it's targeted prevention based on your unique biology. Let me give you a practical type O protocol for longevity. Your gut is your primary vulnerability, so protect it actively and consistently. That means limiting the long-term use of non-steroidal anti-inflammatory drugs, things like ibuprofen and aspirin, unless they're medically necessary. These medications can erode the gastric lining in anyone, but in type O individuals, they're landing on tissue that's already operating at higher biological risk. Incorporate fermented foods into your regular eating pattern. I'm talking about kefir, miso, kimchi, naturally fermented pickles. These are not trendy extras or passing wellness fads. For type O, they're practical tools for maintaining a gastric environment that is more resistant to bacterial colonization. And physically, your body was built to move. Type O blood is associated with higher baseline catecholamine activity. That means your nervous system naturally runs on a bit more dopamine and norepinephrine than other blood types. When that energy has no physical outlet, it doesn't just disappear. It converts into restlessness, disrupted sleep, and over time, it leads to cortisol dysregulation. 30 minutes of walking every day, plus 2 sessions of resistance training per week, will do more for your long-term metabolic health than any supplement stack you could buy. So here's the summary for type O: cardiovascular strength is your inheritance. Your stomach is your responsibility. Don't let the first one make you complacent about the second. Before we move on, I'd love to know your name and where you're watching from. I read every comment and it genuinely helps me know who I'm sitting down with today. Now let's talk about type A. I want you to lean in for this section, because this is the blood type where the gap between what people think they know and what they actually need to know is widest. Type A emerged as human populations began transitioning toward agricultural living. We started settling in denser communities. Social environments became more complex. Exposure to a broader range of infectious agents became part of daily life, and the immune system adapted to meet those pressures. People with type A blood mount aggressive and effective immune responses, particularly against viral pathogens. In your younger years, that's a genuine biological asset. It serves you well. But here's where the blood type story gets complicated, because what protects you in your 30s and 40s can begin to work against you in a different way by the time you reach your 60s. Type A blood carries higher coagulation activity. The platelets are stickier. The clotting proteins are more active. There was a landmark study out of Harvard that tracked nearly 90,000 adults over 20 years. What they found was that type A individuals carry a roughly 5% elevated risk of coronary heart disease compared to type O. Now, 5% might sound modest when you hear it in isolation, but here's what makes it clinically significant for type A specifically. When you layer chronically elevated cortisol on top of that already stickier platelet activity, the compounding effect over decades is what transforms a modest statistical difference into a real cardiovascular event. The risk isn't just in that number. The risk is in what your stress biology does to that number every single day. And that brings me to the layer that most discussions completely miss. The reason this risk is so significant isn't only mechanical, it's hormonal. Type A individuals tend to maintain the highest baseline cortisol levels of any blood type. Cortisol is your primary stress hormone. In short bursts, it's genuinely useful. It sharpens your focus. It mobilizes glucose. It prepares your body to handle a challenge. That's what it's designed to do. But when cortisol runs chronically, elevated week after week, month after month, it does something very specific to your arteries. It inflames and stiffens the endothelium. That's the thin, delicate inner lining of your blood vessels. Now here's the mechanism that I want every type A man and woman watching to understand. When your endothelium is inflamed and less elastic, it becomes a surface that those sticky platelets we talked about preferentially adhere to. So you have two things happening at once: the elevated coagulation activity of type A blood and the chronic cortisol-driven inflammation of type A physiology. These are not two separate risk factors sitting in isolation. They form a compounding cycle. Each one makes the other more dangerous. What this means practically is that for type A individuals, stress management is not a luxury or a wellness preference. It is direct cardiovascular medicine. It belongs in the same mental category as blood pressure medication and cholesterol management, because physiologically it's addressing the exact same underlying pathway. If you're type A and over 55, getting your blood pressure checked every 6 months rather than annually isn't being overcautious. It's appropriate clinical monitoring for your specific biology. And here's something else I recommend. Ask your doctor to include homocysteine in your next blood panel. Homocysteine is an amino acid that, when elevated, actively damages your arterial walls. Type A individuals tend to trend toward higher homocysteine levels, and the intervention is remarkably simple. Adequate folate, B12, and B6. You find these in dark leafy greens, eggs, legumes, and lean proteins. This isn't expensive or complicated, but it's specific to you. And please build a daily cortisol reset practice. I'm not talking about a weekend retreat. I'm not talking about an occasional meditation session when you remember. I'm talking about something you do every single morning before the day gets its hands on you. Diaphragmatic breathing, 4 seconds in, 6 seconds out. Practiced consistently for just 10 minutes, this has measurable effects on cortisol regulation in clinical studies. The consistency matters far more than the duration. 5 minutes every morning will outperform an hour on Sunday by a significant margin. I see this in my patients all the time. So here's the picture for type A: powerful immune resilience, but elevated cardiovascular risk driven by a stress hormone that your blood type tends to keep chronically elevated. Managing that hormone is one of the most important health decisions you'll make this decade. If you're still with me and finding this helpful, take a moment to type the letter A in the comments. It lets me know you're here and getting value from this conversation. Now let's turn to type B. Type B is the blood type that conventional medicine often understands the least, that mainstream wellness culture tends to handle the worst. Type B emerged among nomadic populations moving across the vast interior of Central Asia and the Himalayas. These were people constantly adapting to new food environments, new climates, new infectious pressures. The immune system that developed in that context is genuinely remarkable in its metabolic flexibility. Type B individuals can efficiently process a wide variety of proteins, fats, and carbohydrates without the kind of inflammatory friction that other blood types sometimes produce in response to dietary variation. That adaptability is real, and in the context of how we evolved, it was a profound advantage. But here's the clinical problem: that most type B individuals over 55 are carrying around without realizing it. Type B carries a distinct and not yet fully understood immune signaling profile. What the research does consistently show is that type B individuals have a broadly adaptive immune response, one that processes a wide variety of dietary and environmental inputs differently than other blood types. Studies confirm that type B individuals have a measurably different gut microbiome composition, and certain inflammatory dietary triggers, things like refined seed oils, ultra-processed foods, high-fructose corn syrup, appear to generate stronger systemic inflammatory responses in type B compared to what you'd see in other blood types. The autoimmune picture across blood types is still being actively studied, and the findings are genuinely complex. What is clear is that keeping your inflammatory baseline low through diet, movement, and regular monitoring is the most evidence-backed protocol we have for type B longevity. If you're type B and you've been managing symptoms like persistent fatigue, joint discomfort, or digestive issues with lifestyle adjustments alone, dismissing them as just getting older, I want you to hear this. It is worth having a direct conversation with your physician about autoimmune screening. Early detection of autoimmune conditions changes the treatment trajectory dramatically. It can make the difference between managing something well and struggling with something that's been quietly progressing for years. There's a second issue that's specific to modern life for type B individuals. The modern food supply has become what I would call a calibration problem for your immune system. Refined seed oils, ultra-processed foods, high-fructose corn syrup. These things don't just represent empty nutrition. For type B individuals, research points to these inputs as particularly potent triggers of systemic low-grade inflammation. The kind that runs below the surface for years and progressively distorts your immune precision. Your C-reactive protein level, or CRP, is a standard inflammatory marker available on a routine blood panel. I recommend monitoring it at least annually. A consistent CRP reading above 1 mg per liter, without an obvious acute infection, is a meaningful signal. It means your immune system is running in a chronically activated state, and you need to find the trigger before the trigger finds you. When it comes to exercise, type B physiology responds best to sustained moderate-intensity movement rather than repeated high-intensity bursts. Cycling, swimming, hiking, and consistent walking protect your inflammatory baseline far better than interval training regimens that generate sharp spikes in inflammatory markers during recovery. Here's how I see type B: you have the most metabolically adaptable blood type on the planet. Keep your immune system precisely calibrated, and it's one of your greatest assets. Let it run unchecked, and it becomes one of your most serious vulnerabilities. Before I move on to the next section, if this is helping you connect the dots about how your body might be responding to what you eat and how you live, do me a small favor and hit the like button. It helps this kind of practical, research-based information reach more people who are quietly dealing with fatigue, inflammation, or health issues they can't fully explain. And tell me in the comments, have you ever been told you might have an autoimmune issue? Or has it always been explained away as just normal aging? I read every comment, and I'm genuinely curious how often this gets missed or overlooked. Now let's talk about type AB. Type AB is the youngest blood type in human evolutionary history. It appeared relatively recently when populations carrying type A and type B antigens began mixing at scale, and because of that dual inheritance, it carries a genuinely unusual immunological profile. On one side, type AB inherited the immune tolerance tendencies of both parent types. AB individuals often show lower inflammatory responses to certain environmental antigens. That translates into a meaningfully reduced risk of some gastrointestinal cancers and certain gastric pathologies compared to other blood types. But here's where I need you to pay close attention, because what type AB gained in immune tolerance, it came with a cost, a neurological vulnerability that the research has made increasingly difficult to ignore. Type AB individuals carry a statistically elevated risk of cognitive decline, including vascular dementia, compared to type O individuals. The mechanism here is cerebrovascular. Type AB blood carries elevated coagulation factors inherited from its a component, combined with the cardiovascular complexity of the AB antigen profile. Over decades, this creates subtle but cumulative changes in blood flow through the brain's smallest capillaries. These are the microvessels that service the regions most responsible for memory consolidation, processing speed, and executive function. These aren't dramatic blockages that announce themselves with obvious symptoms. They're microscopic, gradual changes in perfusion efficiency across neural tissue. Most people would never notice them until the cumulative effect has been building quietly for 15 or 20 years. This is why, for type AB individuals, cardiovascular health and brain health are not two separate conversations. They are one and the same. Blood pressure control, blood glucose management, cholesterol and triglyceride monitoring. Every single intervention that protects your arterial health is simultaneously protecting your cognitive longevity. Let me give you something specific. DHA, the long-chain omega-3 fatty acid found in fatty fish like salmon, sardines, and mackerel, is incorporated directly into the cell membranes of your neurons. It maintains membrane fluidity and reduces the neuroinflammatory signaling that accelerates small vessel disease. 2 servings of fatty fish per week, or a high-quality fish oil supplement discussed with your doctor, is not optional supplementation for type AB individuals. It is targeted neuroprotection based on your specific biology. Sleep is the other non-negotiable. During deep sleep, your brain's glymphatic system, its internal waste clearance network, flushes out accumulated metabolic byproducts that includes the amyloid proteins associated with neurodegeneration. Consistently sleeping under 6 hours meaningfully impairs this critical cleaning process. For type AB individuals, chronic sleep restriction is not just about feeling tired the next day. It is accelerating the very biological process your blood type already makes you more vulnerable to, 7 to 8 hours every night. This is your most powerful daily intervention. Here's the summary for type AB: impressive immune tolerance and a brain that requires deliberate, consistent, long-term defense beginning now, not at 70. Now, if you're still with me and this is making sense so far, just type the word "helped" in the comments. I genuinely read them, and it helps me understand what's landing with you. Now, before we close, there is one more variable that almost nobody includes in these conversations. And it matters deeply: the Rh factor, that plus or minus at the end of your blood type designation, Rh positive or Rh negative. Roughly 85% of people are Rh positive, meaning they carry the Rh antigen on the surface of their red blood cells. The remaining 15% are Rh negative, and this difference is not cosmetically minor. Rh-negative individuals appear to carry a modestly different cytokine signaling profile. That means the chemical language your immune system uses to communicate is calibrated differently than it is in the majority of the population. Research is still working to establish the full clinical significance of this, but what is emerging suggests that Rh-negative individuals may have heightened sensitivity to certain inflammatory triggers. What that means practically is that regardless of your primary blood type letter, if you are Rh-negative and you manage any chronic inflammatory condition, the anti-inflammatory protocols I've outlined today are even more relevant for you. They should be implemented more rigorously. And for women who are Rh negative, this is critically important. If you are pregnant or planning to become pregnant and your partner or baby may be Rh positive, this is a medically essential conversation to have with your obstetrician immediately. Rh incompatibility during pregnancy is absolutely manageable with appropriate medical intervention, but it requires that intervention, and it requires it proactively, not after the fact. So please, know your complete blood type, the letter and the sign. Make sure your physician has both on record. Now here is the most important thing I am going to say today, and it's the thing that most blood type content completely avoids. The statistics are real. The risk elevations I've described are documented in the medical literature. The biological mechanisms are genuinely significant, and they are not your destiny. I have watched type AB patients in their mid-70s with sharper cognitive function than colleagues 15 years younger. Not because their genetic risk profile was somehow different. It wasn't. It was because they understood what their biology was working against, and they built their daily lives around addressing it with quiet consistency. They slept 8 hours. They ate 2 servings of fatty fish every week, not just when it was convenient. They maintained their blood pressure below 120/80 consistently, not just when they remembered to check. They kept learning genuinely new and challenging things, not casual scrolling on a phone, but real cognitive engagement that challenged their brain to form new pathways. Their risk was still present. The statistical profile still applied to them. They simply chose to meet it directly rather than let it accumulate quietly in the background for decades. The gap between genetic predisposition and actual health outcome is not small. It is enormous, and it is filled entirely by choices made consistently. Over years, that gap is where your decisions live. Your blood type is not a sentence, it's a map, and a map is only useful if you're willing to look at it. Now tell me something, what is your blood type? And does the profile I described today match what you've actually been experiencing in your own health over the past few years? Drop it in the comments. I read every single one, and what comes up consistently in this community genuinely shapes the topics I cover next. If you found this useful, there is another video linked in the description where I go through the 3 most commonly missed root causes of persistent fatigue and high blood pressure in men and women over 55. These are conditions that are absolutely addressable when caught early, and in my experience, they're almost always mismanaged when they're not. Take good care of yourself. You have carried this body a long time. It is worth understanding exactly how it works.